Nigeria has a large adolescent and youth population, with more than 1 in 2 people under the age of 24 and 41% of women of reproductive age within the 15 to 24-year age group. Postpartum women have the highest unmet need for family planning in Nigeria, with only 6% using any modern contraception 6 months after delivery. Supporting the state governments through their ministries of health, the community-focused approach for post-pregnancy family planning services, PoPCare, a 4-year project, was funded by the Bill and Melinda Gates Foundation, implemented by Clinton Health Access Initiative in partnership with the Center for Communication and Social Impact and Tulane University. The aim of the PoPCare project was to increase the uptake of post-pregnancy family planning services among young first-time parents in high-home delivery settings in Lagos, Nasarawa, and Rivers State of Nigeria. The PoPCare project was implemented in a total of 11 selected local government areas and used a community-focused approach to increase the uptake of family planning services and reduce unintended pregnancies and unsafe abortions. In Nasarawa State, these were Lafia, Nasarawa, and Nasarawa Egon. In Lagos State, Amuwo Dofin, Ibejuleki, Ikorodu, and Lagos Mainland. And in Rivers State, Akuku Toru, Asari Toru, Degema, and Bolo. Across the 3 PoPCare states, family planning demand generation activities were conducted by community volunteers. These community volunteers served as foot soldiers, referring young first-time mothers aged between 15 and 24 years old and women of reproductive age to PoPCare-supported facilities. At the facilities, trained service providers counseled and provided them with appropriate family planning information to make an informed choice for a family planning method that best suits them. The PoPCare project also trained traditional birth attendants, TBAs, in Lagos and Nasarawa states, and community reproductive health influencers in Rivers State, who also referred young first-time mothers aged between 15 and 24 years and women of reproductive age to make informed decisions and take up an appropriate family planning method from PoPCare-supported facilities. The project carried out interventions in the local government areas through the state government's leadership while leveraging on community structures to provide family planning information and services. Through a human-centered and participatory approach, highly visual appealing and emotive social and behavioral change communication materials were produced in 4 languages: English, Pidgin, Yoruba, and Hausa. Rivers State, popularly known as the treasure base of the nation, is a state in the oil-rich Niger Delta region of southern Nigeria. A few stakeholders had this to say from Rivers State.
PoPCare was able to develop and inaugurate the traditional medicine unit. So now we have the traditional medicine unit in the ministry, and then having it, not just having it alone, they equally inaugurated a technical working group that usually go and supervise these people. PoPCare program, we're able to train emergency volunteers. So these emergency volunteers, what do they do? For instance, you have in the community, you have the hard to reach areas. So this hard to reach area, assuming a woman is in one of the community reproductive health influencers' house, and then this woman maybe wants to deliver, and then the woman has an issue. So quickly, what the community reproductive health influencers will do, because they are being linked to a facility. So what they will do now is just to call on the emergency volunteer drivers. So what they will do is to come, they pick up the client. They don't even talk about money at that particular time. They pick up the client and then take the client to the health facility that they link that community reproductive health influencer, and that person will be attended to before even the person will come and talk about money.
I've been going from door to door, house to house, from wherever programs are organized, we go there, we advocate, we speak about family planning, especially the young time first mother, those ones that are coming up, those ones that they have future, those ones that they need to plan their family so that they can go back to education after delivery.
My experience starting from 2018 when the project started, they came to the LGA, they trained us, and from time to time they have been coming to do refresher training for us. As the project is going on, we are learning more, and it has come to build up me. In the community, people they know me as a community volunteer. People will just walk up to me, to come to me, and that alone gives me a lot of happiness. I'm so happy to work on the PoPCare project.
Before the PoPCare came, the family planning, we have low clients, but now it's very high. We are having more than 1,000 in a year. But before, it's not even up to 50. Now the TBAs, they are working hand in hand with us, with the LGA. The WDC now even make sanction on the TBAs to send people to us. And when the clients, the mothers is unable to do, and they come to they will send them to the health center. When they come to the health center, through there, we are going to health educate them on family planning, child spacing. When we introduce them to we introduce the family planning to them. Even the mothers, when they go, they tell the TBAs how we are taking care of them.
Young first-time mothers who take up their preferred choice of family planning method can improve their quality of life and pursue their dreams. This is Ngowari's story.
Looking back from 2019 and this is 2022, there's a lot of impact that PoPCare has actually done in my life. I want to further my education. I want to become a fashion designer. So yes, I want to continue. I want to go around the world. I've been able to mash machine, been able to sew. At least I've done things that I haven't even been able to do before.
The family planning method I took was implants, and I took it to the year 2019, and I've been well with it and I've been okay. Though some people will actually say they are having issues with it, but I've been comfortable, no complaints, just okay with my system. And I'm just still doing my things, everything I've been doing, I'm still doing it. Just okay, it's fine with me.
Because I consider my first child as a mistake and I don't want to make any other mistake, what I'm not ready for. The father of my child is also happy with it. He's even comfortable with me taking the injection for the family plan.
The PoPCare program don't help me better my work, because before this time, I don't know anything about family planning. But as PoPCare program come now, I don't know something about family planning. Family planning, they very important. They get plenty importance. Number one, it go help you space your children. Then it go still help you maybe woman or even the man. If you want further your school self, as you plan your family, if you further your school. If you want start any other trade too, it go fit to one. Don't help me learn so many things. Like before this time, I know they tell my clients say they fit space their children as then they born. As they come to me, I refer them to the health center. I also tell them about family planning.
A community volunteer recognition event took place in Lagos, Nasarawa, and Rivers State, and the best performing community volunteers across the 11 local government areas were identified and given awards. All the community volunteers received certificates of appreciation.